Welcome to the Health Daily Show. I'm your host, Chitra Nabat. Joining us today is Dr. Sachin Jain, President and CEO, Scan Group and Health Plan. Sachin, welcome. Thank you for joining us.
Thank you, Chitra. Great to be with you. Thank you for pronouncing my name the way my parents intended for it to be pronounced. I appreciate that.
You're welcome. Tell us about your organization and what's unique and challenging about ensuring your member population.
So Scan Group and Health Plan was founded in 1977 by a group of community activists in Southern California, in Long Beach, in fact, with the goal of keeping seniors healthy and independent. And over the past 45 years, we've evolved in our form while our mission has remained consistent. We are now a Medicare Advantage plan. We serve over 280,000 Medicare beneficiaries, primarily in Southern California, but we've expanded recently to Arizona, to Nevada, to Texas. And we've also gotten into the business of care provision. We have 4 operating divisions that are focused on care delivery. Welcome Health is a home-based geriatrics practice. Healthcare in Action is our medical group for people experiencing homelessness. My Place Health is our PACE entity in collaboration with Commonwealth Care Alliance. And then Home-Based Medical is an acquisition that we recently completed. It was originally called the Residentialist Group, which is not a great name. And so we've renamed it Home-Based Medical, and that's focused on chronic disease management and palliative care for older adults. I'd say the thing that differentiates SCAN is its nonprofit status and its exquisite focus on older adults. I think that makes us pretty unique in the marketplace. And I think we feel a strong degree of obligation to be thought leaders in the space of management of the care of older adults.
Bring this to life for us, the exquisite care of older adults. Bring this to life for us operationally in terms of your operating model and your business model.
I would say our operating model is really focused on providing benefits that we believe differentially keep people healthy and independent. And we partner with a number of network providers, important network providers across all the markets in which we operate. And I would say, over time, we hope to drive increasing differentiation through some of the care delivery assets that we've incorporated over the last number of years. We believe that it's the interconnection between different nodes of healthcare delivery that actually creates the greatest value for patients. And most people experience care as a commodity. Most people experience care that's kind of for everyone, and we believe that this focus on older adults allows us to think very differently about the structure and organization of care and do things like really provide care in the home, provide them with benefits that really meet the needs of the moment. Last year we grew by over 50,000 members. We're the fastest growing Medicare Advantage plan in the country, in part because we recognize the inflationary trends that people were experiencing and actually added a benefit that put dollars back in their Social Security checks to help them pay for food, pay for rent, pay for electricity bills. Those are the kinds of things that older adults need in times like the ones that we're living in right now, where there is more inflation, where the cost of the Part B premium has gone up because of new drugs that are being introduced for Alzheimer's and other conditions. And so we're really thinking about the member. The other thing I'll say that really differentiates us, and I will double and triple down on this across this interview, is our nonprofit status. I think Americans are sick and tired of people ripping them off and giving them kind of a substandard care experience. And every one of us who's got a parent or a grandparent knows that the care experience is not what we would want for ourselves. I think that's the opportunity that we have ahead of us.
So there's 2 consistent trends in healthcare: consolidation and providers and payers coming together to become payviders. You talked about your acquisition earlier this year. How will you drive growth?
Look, consolidation is something we got to keep a really close eye on. Consolidation across hospital systems, medical groups, health plans has never been good for patients. What I mean by that is usually we don't see any real improvement in outcomes, and we see increases in costs. This goes against everything that we're trying to create in the healthcare system. Every value-based care zealot should be looking really hard at the consolidation trends that we're seeing and ask themselves, is this good for patients or bad for patients? I know the standard talking points that big groups use when they're consolidating, and I would say most of it is nonsense. It's not great for patients. And so I think we have to look at these trends and think about, do we have competitive markets in healthcare, competitive markets for benefits, competitive markets for providers? And I would say and we should look at what consolidation has done for prices in most markets. And I would say what it's done in most markets is increase prices. Our model is pretty different. Our model really involves close partnership with medical groups, and we delegate a lot of risk to the medical groups. And what that means is we get X from the government for Medicare beneficiaries. We use some amount of that to fund our operations, some amount of it to fund what we call our supplemental benefits. And then we say to the medical groups, we're going to delegate the risk to you, because ultimately as doctors and hospital systems, you know how to manage that risk and manage the care of patients better than we do as a health plan, even though I'm a physician, recognize the power that medical groups have to actually manage that risk. And so in that way, we have a close partnership with provider groups that others don't enjoy, because we're not doing things like managing their utilization. And the traditional sources of friction and abrasion that exist between health plans and provider groups are not part of our model. And so it's something we call virtual provider integration, which really is about trying to operate as one health plan and provider group by creating the connective tissue that actually creates value for patients.
You've got 1% of the Medicare Advantage market.
I wasn't aware of that.
Research.
1%, woohoo!
Research that I've done.
Yep.
You're talking about delegating risk.
Yep.
Value-based care. How do you get to value-based care at scale?
Look, there's a value-based care, and at this point in our industry is code. It's code for pay me the same amount that you've always paid me, but just let me figure out how it gets distributed. There's not a lot of cost savings that's been coming from value-based care. There are not a lot. I was part of the founding team at the Centers for Medicare and Medicaid Innovation. I think we have a lot of hope for value-based care. But I think we have to take a big step back and say, is value-based care in its current form or iteration actually leading to lower costs? And I would say there's not a lot of evidence that it does. I think there's been some demonstrations within the ACO program, some demonstration with some commercial payers, but largely our healthcare system is still dominated by a fee-for-service chassis. I think we've got to get real about what value-based care is today and what it isn't and what it should be. I think what it should be is a way for us to actually take healthcare costs out of the system. How do you take costs out of the system? You take costs out of the system by actually needing less of it, by keeping people healthier. How do you keep people healthier? We invest more in prevention. We invest more in chronic disease management. We invest more in the kinds of things that actually create real benefit for patients and families. And that's not what we have right now. What we have is a lot of people saying, pay me the same amount, I'm just going to distribute it differently. That's not going to get us to where we need to go.
You use this word code, so let's talk about leadership. In career, business, life, there are codes, rules, norms, and how things are done. Where have you been a code breaker in career, your life journey? How did you do it?
I would say my whole career has been some version of code breaking, to be honest with you. I left medical school at a time when many people weren't leaving medical school to go to business school. That's where we, I think, overlapped a little bit. 2005 to 2007, I was in business school. Nobody was taking a leave from medical school to do that at that time. Certainly not in the numbers that they are today. Middle of residency, nobody leaves their residency midstream. But Obama was elected president. I was super inspired. I knew that health reform was on his agenda. I left, went to work on health reform. I was a Boston-trained physician. That's code for certain things. Most Boston-trained physicians are pretty anti-pharma. Coming straight out of residency, I went to work at the VA as a clinician, but I also went to work in pharma and as an executive at Merck, where I led the digital health portfolio there. And then, as a Boston-trained physician, I picked up and I moved to California. I did the craziest thing. I moved to California to work for a little managed care company called CareMore, which is a division of Anthem. Scaled that organization from just doing Medicare to doing Medicaid managed care delivery. Built a bunch of programs. Tried to kind of define loneliness as a disease. I think now we kind of recognize that more and more in society. Came to SCAN 2.5 years ago and said, look, this nonprofit has the bones to be something even bigger and better than what it is today. And so we're trying to approach the growth and strategy of the organization as a nonprofit with the nonprofit values, but with for-profit discipline and ambition and growth. So I would say there's a lot of kind of code breaking implicit in all of that. It's been rewarding, but it's sometimes lonely, to be really honest with you, because I think sometimes you're going against the organizational grain. My personal thesis is that we have all the policy tools that we need, we have all the business tools that we need to change healthcare, but I don't think we have the leaders and leadership to change healthcare. And kind of before this conversation, we were talking about leaders who make a difference in the world, the motto of the business school that we shared. I think we need a generation of leaders in healthcare who are going to talk about, doing business differently, embedding, kind of the values that we want in these organizations, and kind of going against that grain. So I do think we need more and more code breakers.
Sachin, thank you so much for joining us.
Thank you for this conversation. Really appreciate it.